next speaker is Conni Calia. She's a NYS certified school psychologist and mental health professional, and she's going to talk to us about if, when, and how talking to your child's school about ALD.
Good afternoon. Thank you so much. I just want to say that I am honored to be here today to participate in such an important organization and to share my knowledge of the school system and how it works with students who may need additional support, whether medical or other types of accommodations. I have worked in the Department of Education for over 20 years, and I specialize with children with disabilities and also special education. Excuse me. In the school system, there is many different types of support and accommodations you can seek out, and it's important to know what those options are, because if you're not in that atmosphere and you don't know, it's very hard to get the information. So we're going to focus on if, when, and how you're going to talk to your child's school about the diagnosis. So first, informal collection of the responses from parents of children. We're going to discuss that, and we're going to read some of the experiences that parents have had already and give their opinions. Then we're going to talk about the different options, because depending on the disease presentation and other outside factors, your choices can be very different than somebody else's. And then last, always speak to your ALD expert for advice on what to do with your child, because I'm sure that they've had experience and they could lead you in the right direction based on your personal situation. So first, the phenotype variability for school-age children, that will play a very important role on your decision making. So children who are asymptomatic and they don't have symptoms in school, and that's not something that is apparent in the school system, you have the choice, more of a choice, to keep that information to yourself or share it with the school. Parents have made both decisions and have had good and bad experiences, but that is a personal decision, and it gives you more options. Stress dose only. Children who may need medication or treatment only under stress, that's something that you may be able to talk to your school nurse about. It doesn't have to be something that you go directly to the teachers or the administration. It could be just a medical documentation that you give the nurse, so that way she understands if there is an emergency that she's there and what could happen if she needs to come to the classroom or to be there for the student. Addison's disease. This is also something that you would need to speak to the nurse about, because if there is daily medication that needs to be given to the child, you want the nurse to understand what the disease is about, the medication, and to give them more information. And then heading into treatment for cerebral ALD, this is something that the school would need to know as well, because you need to maybe get some information on how to process the changing, maybe getting them support in a hospital or in the organization that they're in, so that way they could be educated in that institution or that area. And then post-treatment of cerebral ALD, acclimating back into the school system. So now you're coming back with many different needs. You may have accommodations that need to be discussed in school, and these accommodations could range from, just maybe having a shorter day or less stress, to really getting more intense academic support for what the student or the child has missed out on while they were out. So formal tools that the schools use, These range as well. So there's a school physical or medical form that all students give to the school, and that information is filled out by your doctor. And it could be also something that you could decide if you want ALD or a diagnosis like that on the medical form, again, depending on what your specific situation is. There is also a 504. This is a medical plan that is primarily used for medical diagnoses. So it will provide the child with medical accommodations in the school building. Those medical accommodations could vary. It could be giving medication during the day. It could be accommodations when it comes to the academic work that the child is doing. Maybe they can't keep up. Maybe they need to go to the nurse often. Maybe they have difficulty with their vision or hearing and they need tracking support or visual support. And then there's also paraprofessionals that are given on a 504, and those are health paras. Those paraprofessionals are trained in identifying symptoms, being able to go to the nurse with the child when the child needs to go to the nurse. They escort the child to the nurse for medication, and many more responsibilities. And then there is the IEP. An IEP is an individualized education plan, and these plans are for students who are identified as having a disability. So in New York, there are 13 classifying disabilities that we recognize. And one of the disabilities would be other health impairment. And that's what maybe one of your children would be used as a classification in order to receive accommodations, modifications, and specific services in the school. The individualized education plan is very important because it is a complex legal document that identifies your child's strengths and weaknesses, and it will explain to whoever is going to be reading that IEP what your child is dealing with, what supports they're going to need, whether that's academic, emotional, medical, everything would be put on there. And that would be directly shared with the teacher and the administration as well. So that is more of a complex plan. And anybody who is working with the children is legally mandated to read the plan, understand it, and put forth the recommendations that are in that plan. And then there are informal tools. And these are up to the parents and how you're going to discuss your situation with the educators that your child is dealing with. Meeting with school staff, that's wonderful. I always recommend to meet within the first couple of weeks of the year, maybe not the first week or the second week, because teachers are very overwhelmed and you might not get their full attention. But after the second week or third week, speaking with the teacher is always beneficial. I also recommend that if your child is having symptoms and it's something that needs to be, there are certain treatments or accommodations that need to be done, always having an administrator be part of that conversation, because the more the administrator is involved, the more the teacher then can go to the administrator and say, well, this is what we need to do, and we just want to make sure that you're able to provide those accommodations. Emails and letters to the school staff. I also always recommend to my parents to email and to write a letter. Once something is in writing, and I prefer email because once it's in writing, whoever receives that email is now responsible for that information. If you go informally, maybe somebody forgot what you said or they didn't truly understand. But if it's in writing, that teacher or that educator can always go back and refer to the information so that way they could have those reminders and understand. There are also credible websites like the ALD Alliance, ALD Connect, some of the great information that's been shared for the last 2 days. These are things that you can share with your teachers, your administrators, your school staff as well. Because once they're a little bit more educated on exactly what ALD is and what the implications are, they can better make decisions in the school building. There's also a parent's guide to ALD that I'm sure has been shared. And then there are also personalized brochures. And we will show that to you at the end of the presentation, but you could make a brochure about your child so that way they could see their face, they could get more personal information and understand, because you never know, there are teachers that come in and out of the classroom. There might be a different art teacher or a substitute teacher, and you want to make sure that everybody has the information, especially if they need to be attended to on an emergency basis. So consideration for asymptomatic boys. That choice is really what your family and what you decide together is best. You could decide to communicate that information, or you could decide not to. It really depends, and it also depends on the age of your child and the circumstances. You can include your child in the conversation, and again, that depends on age and maturity. You want to always make sure that the child feels comfortable in the school. I know as a parent, and with dealing with parents for many, many years, I've assumed that if I say something, it's okay, the child's going to be okay with it. But I would say 7 out of 10 times, my children are not okay with what I say. And the other children that I work with and their parents, they can be very embarrassed, uncomfortable. So it's always important to have that conversation with your child before. Give them a little indication of what you're going to say. Decide if you're going to include them in that conversation, and then help them with the decision making. Maybe they would like you to keep certain things to yourself and certain things to be shared with the school. Possible school absences for appointments. Those appointments will always be excused. So even if you don't have a letter from your doctor, if you tell the school that you're going to the doctor for a specific reason, it is excused. They will take the parent's word for it. So those absences should never be held against the child when it comes to applying for middle school or high school, or for any other type of awards or scholarships in the school. And then another indication that really we should consider is educating others on ALD and how to advocate. Elisa, she has done that for the last 10 years, and I have to say, I meet people all the time that talk about ALD just because of the advocating that she has done. The schools that I've gone to, their understanding of ALD now is much different than it was years and years ago. So I think it's important that sharing the information, and as scary as it is important, because the more people that know, the more they could identify symptoms and situations and have compassion towards you and your child. Oftentimes, educators don't realize that people are going through a struggle in their lives, and they will jump to conclusions or maybe even not be so sympathetic. But if you let them know that you are going through a stressful situation and what's happening, their demeanor, their reaction, their attitude will change. So this is from a parent who would like to share her experience. She said, "Our kids are in a school setting just as much, if not more, when they're with us." And that's true. All day, your children are with teachers, other children, so it's a very important part of their day. It's a great opportunity to educate the school about ALD and what to look for. With all this newborn screening, the chances of another ALD family going through your schools is on the rise. My son has been on a 504 plan for 4 years, and I've never once seen or heard him be treated differently, despite the school not knowing what ALD was before him. I would honestly be terrified for him to be in a school setting without staff being educated. This is from another parent. I told his preschool teachers, and it wasn't an issue. They were very supportive and didn't treat him any different. But his kindergarten teacher's response was so surprising to me. I feel like he doesn't get it, and that me telling him wasn't helpful. because now he has an excuse to blame his diagnosis rather than just looking at him like a 5-year-old kid, new to structure, new to kindergarten, new to the school, with new friends, etc., and rather than see him for who he is. He is looking at him through an ALD lens that is so unnecessary. And because he doesn't get it, if his behavior were to change because of ALD, I don't trust that he would pick up on it because he doesn't see him clearly as it is. So for me, going forward, I will take this into consideration, that not all teachers are going to understand the way I had thought they would. And it's true, not everyone's going to understand. And being more open, and I know it's hard to be open, but being more open and just going back and reiterating with the teachers and giving them a better understanding will help. Because and I think also teachers are human and they are compassionate and they don't always know how to react. So they might be oversensitive to looking for symptoms or wanting to make sure that everything is going well in the classroom. This parent states, as for missed days due to monitoring, we have wiggled our schedule so that way MRIs fall during the February school break and during the summer. So missing school days is not an issue for us. At some point, I expect within the next year or so, I think he will probably start talking more about this and his MRIs and blood work outside of the house. Our philosophy, while he's asymptomatic, is to try and let him lead the conversation in terms of when he is ready to start talking about it and telling people. This is what has worked for us, and honestly, one less stressor is having to explain the variability of the disease to another set of people. So that's a different perspective. Sometimes you want to just let things be for a while and focus on the priorities. Consideration for boys with adrenal insufficiency. So these are considerations, but of course it's a personal choice. You could decide how much you want to share, but informing the teachers, the school nurse, all coaches for extracurricular activities is important. Giving them maybe even something hard copy to see the signs of an adrenal crisis. An emergency health plan, often written by your doctor. You could give that to the school or to any extracurricular activities as well. There are rules for field trips and also lockdown rules. You never know if your child needs medication, even if it's stress dose medication, you want to make sure that that is indicated in their health plan, their medical plan, and the nurse understands that if there is a certain amount of time that the child's in the school, that they have to be on target for that and responsible for that. And then the 911 response time to the school. So this is something that also needs to be considered because adrenal stress or an adrenal crisis, treatment or medication needs to be given within 30 minutes. So you want to understand how long it would take for an ambulance to get to the school building that your child is in. Considerations for a cerebral ALD. Again, there are formal tools for school documentation. We have the 504, IEP, medical plans, crisis plans, support staff at the school. This is important because the teachers, like I said before, they have 20, 30 students in a classroom. They have a lot of responsibility. There are plenty of individuals in a school system to give support that are not in the classroom, that could focus more on the details and can always be there to provide the teachers and the school extra support when something happens. So there are guidance counselors, there are school psychologists, social workers, family workers, parent coordinators. These are all people that you could go to make sure that your child is being supported in the school. Absences for treatment and post-treatment care. This is also something that is accounted for in the school systems. There's homeschooling. If your child's out on a medical leave, they are entitled to homeschooling. They're entitled to get educated or academic support in other areas. If they're in a hospital, they do provide it as well. Homebound instruction after treatment, so that's what I was just speaking about. Phased back to school planning. So that's important because it's, your child's going to be going back into a classroom where they might have missed a lot of work, academic work, social, emotional, missing out on friendships, feeling uncomfortable, their self esteem, or just feeling self conscious about going in, definitely look into speaking to the school support teams again so that way they know that. It could be something as simple as an informal check in and check out. In the morning, somebody could just see your child, say hello, how are you doing? You're having a good day. After lunch, it's very informal, but it's always good to have that contact person. And then navigating post COVID-19 school setting and managing risks. So this is also a personal decision because we know that post-treatment children are at the highest risk for infection and also viruses. So, you want to talk to the school what precautions are being done in the school, what precautions there could be for your child. Maybe you don't want your child in the cafeteria with 200 children. Being able to go sit with somebody else at lunch in a classroom, things like that are all things that you could discuss with the school. Schools are able to make many, many decisions. People think that, oh, I don't know if my school's going to do that. They can do it. They can. And if you ask them and you push hard enough, they will. So this from a parent. I'm a big advocate of having a 504. I think it's a great platform to explain ALD and create awareness. I have always sent emails to all teachers, nurses, and coaches. When the school approached me with the idea, I had no clue what it was and was very worried that it would look bad. It most definitely does not and did not. And bonus, it gave me the platform I needed to talk to every teacher, coach, nurse, trainer, etc. that my boys would be in contact with. I used that time to explain how normal my boys were, but also educate them on ALD, my family history, signs, and symptoms. I appreciated the opportunity to educate them, and my boys never felt singled out because of their diagnosis. So that's also something that parents have shown concern in the past. 504s and IEPs are not something that you should feel will look bad. Many children have these plans. They're usually confidential. They're given only to the teacher or maybe the nurse or the administration. It's not something that's hung on the wall or put on their desk. And then once the situation is rectified, whether that's through a medical 504 or an individualized education plan, if your child doesn't need those supports any longer, they're closed, they're discontinued, and that is the end of it. It doesn't follow you anywhere. You don't look it up. Nobody in high school could look up if you had a 504 in, elementary school or an IEP for extra support. Once it's closed, and that information is confidential. Another parent, best thing ever was being open and honest with the staff. Having the time and freedom has been a lifesaver. Right now, because we are still less than a year post-transplant, he is in a medical homebound program that has been amazing. But I would recommend meeting with the principal, the assistant principal, his teachers, and the school nurse. Take the opportunity to educate them on ALD, but more importantly, signs of adrenal crisis. You just never know. So again, it's very important. Speak to everybody in the building to see what resources there are and what options you have for your child. We were very open with the school. He has an IEP being post-transplant. He has some challenges, and the teacher can explain to other kids why writing and other things are harder for him. I have been completely open with them, both from a safety standpoint and from an awareness one as well. I had an opportunity recently to be the mystery reader in his class. After the book, I talked to the class about adrenal insufficiency and ALD. For a group of first graders, they had the most curious and thoughtful questions. Children are very resourceful and they can also be very kind. And I know that a lot of times we focus on the unkind, but when you work with children every day and you go into classes of 20, 30 students, just being able to hear some of the kind words and the way so many children reach out to other children and are compassionate is really wonderful. And I think that a lot of parents and people don't have that opportunity because you're not around children all day. But if you really spent a week in a school, you would be amazed at how wonderful children could be to each other. So this is a sample parent letter that you could use to let the school know and give them some information. It'll talk about the medication. It'll talk about the treatment. Children are really not allowed to have medication with them until they're in the older grades. But this would be a very good resource if you are considering sending something to your school. You could always use one of these letters, and you'll be getting a copy of the document. This is another letter for a 5-year-old boy who likes to play, swim, and it really describes some of the things that he's allowed to do, some of the ways to monitor him, and then also some signs to look out for. And this is the personalized brochure that I was mentioning in the beginning. This is a nice little brochure with your child's face, things you should know, background information, some facts about ALD, maybe even some specific ways that the teacher or teachers in the classroom can support the child, so that way they don't have to wonder what they should do, but more have a specific way of dealing with the child. If you know what's good for your child, that's always good to share with them, because they're not going to know what your child is feeling and thinking inside, but you do. So being specific is wonderful. So while asymptomatic parents, guardians have options with the way they choose to communicate with the school, not everybody does. So the first decision will be how you fill out your medical form. If you have a child with active disease, you will have several tools to utilize, formal, informal, so that way you can communicate with the school as well. And then always discuss the topic with your ALD expert. If anybody has any questions, I'm happy to answer.
Hi, thank you so much. I wish I would have met you a year and a half ago.
Yeah.
So every state is different and every city is different. We live in Seattle, and my son was treated during COVID, so that added an extra level of complexity. And we were told to keep him out of school for a year. While we were trying to figure out what was going to happen, because homeschooling was not going to happen, we got a 504 in place. It took 2 months, so we missed the first 2 months of school. And then he was, because our 504, he could go in a side door and meet with the teacher individually, he was granted 5 hours of education a week. Every school district is different. How do we best advocate for our children so we can get the most out of the system? And really, I mean, now
Yeah,
he's
no.
back in school, but he's now over a year behind in his education, and he feels stupid compared to his classmates, because developmentally he's on the same level as his peers,
Right.
but not educationally. So are there suggestions and resources for how to bolster our children so that they feel success?
Yes, so there are many things that you could do. I do understand, I do know that they do give like 5 or 10 periods through a 504. You could maybe even get some more through an IEP. But I think there's a hierarchy that you can go through to see what options there are. So the first point of contact is always the school, and they suggest what they're allowed to suggest, what the district or what the state allows them to go in, or the district go in and say, okay, you could give them 5 periods or 10 periods of academic support. If you're not feeling heard or you don't feel that that is substantial, you take the next step and you move to the district office. You could speak to a superintendent, you could speak to a deputy inspector, and see what they have to offer, and let them know that those 5 periods are not substantial enough and you'd like more, and how they're going to educate your child, because every child is entitled to an appropriate education, whether that means at home or in a hospital or in a different setting, they are. So districts are able to give more substantial services. A lot of it depends on money. So it depends on how much you push. If you push hard enough, they will spend the money. If you feel that you're not being heard, a parent advocate or a school advocate is important. Not one through the district or your school system, but there are many non-for-profit organizations that will provide you with an advocate, and many of them will do it for free. And those that don't do it for free, all it takes is one visit, one meeting with a parent advocate, and you'll usually get what what your child deserves.
Sorry, just a little follow-up. Is it different? So my child's in a private parochial school. I mean, I'm asking for other parents in the future,
Sure.
but getting public services in a private school, how do you advocate for that?
So that is different. If your child's in a private school and you have signed your rights to educate them privately, the school system is still required to help your child academically if they have a medical condition or if they have a disability. So if your child is classified as having a disability like other health impairment through an IEP, the district is required to give you academic support and any other type of services that your child would need, and it would often be after school. So they could come to your home, you could take them to an agency, but the school system is required to do that.
Yeah, I just wanted to thank you. That was very helpful, and I'm sure. The one comment I wanted to make is with a lot of the boys now with cerebral disease that are being caught and are doing well, and I find that sometimes the school's information on ALD, of course, is important, but I oftentimes try to frame it more in line with what I would tell them for something like ADHD that they know, because I think it's super important that the school realizes that we think of this as a halted disease. So if they think of it as someone that had a stroke or something like that, and now we're working our way back, as opposed to something that we're expecting should continue to decline.
Mm-hmm.
Because I think it's very important that we're not putting an artificial ceiling on where we expect the boys to be, which I think unfortunately sometimes happens. And I think that goes to the comment that the kid made about that this is an excuse. And that's actually a familiar problem for kids with dyslexia and ADHD and all these. And it's a piece of knowledge, and it's something that you are learning how to work hard to overcome, but it's not an excuse, obviously.
Yeah, I appreciate that. I actually, when I work with children and their parents, I often I also often decipher that everybody has strengths and weaknesses. And whether your strengths and weaknesses are something that you were born with, your cognitive skills, or it's something that has occurred over time, that you can always make progress. And you could always work hard. You might not be where everyone else is, but if you look to your neighbor on the left and you look to your neighbor on the right, they're not where you are in other areas. So it's always important to do that. And I think it's true with the different situations, because there are boys that will go in and they don't have symptoms, and then the teachers will be maybe even hypervigilant. But just letting them know to just look for a change. If there's a change that you see, having a hard time seeing, or their like a significant motor change, like that's something that they should look at. But yeah, it's not for both. Yeah, go ahead.
That's okay. I'm flying out soon. But I just also want to be really clear. If your child is asymptomatic, in our opinion, you don't need to be monitoring for vision changes as long as you're getting your MRI. So you're not going to see something as long as you're getting your MRI. That's everybody's fear. And as a mom that doesn't have a child with ALD but has a child, I can't imagine. But kids are weird, and they do strange things, and they learn things, and then they forget them. And I can tell we are very confident on the neurology side that these teachers do not need to be looking, unless they're going to do an MRI on them. They don't need to be looking. If they want to do the MRI, I'm ready to retire.
Thank you. I was going to make the same comment, and thank you. This was a really good talk and can be applied to a lot of chronic conditions that kids have and concerns they have. As an endocrinologist, I typically write on the forms primary adrenal insufficiency for the boys who do not have cerebral disease. I leave it up to the parents whether or not they want to talk about ALD. I think the adrenal insufficiency, if your boy is on hydrocortisone, your school should know about it. You don't, even if they, certainly for stress dosing, but even if they don't need a dose at school, you never know when a lockdown's going to happen. You want to make sure that your boy has their medication, or like an emergency happens, they have to go home with someone else. Just make sure that that is communicated to the nurses. You don't have to use the words ALD when you do that. I think it's your choice if you want to do it. I would also suggest, based on the kindergarten example that you gave, that probably was, and I don't know for sure, but I just Googled when you did that, ALD, and the first thing that comes up is pictures of horrible less scores. And that's what every teacher and educator who sees a letter like that is going to do, unless you've talked to them about it. So I would advocate for setting up a meeting to talk about it before sending a letter like that, because I think the letter, it could lead to exactly what that experience was for that child, where there's a stigma attached to it, and a teacher who's looking for something that's not there. And if the boy is getting monitored, they're going to find it on MRI way before any clinical symptoms show up.
Yeah, thank you. That's great advice. Absolutely.
Right. I was also say, I think talking to people, I mean, the letters are helpful for like a substitute coming in, but I think having the discussion with the classroom teacher makes more sense.
I always suggest a follow-up letter. So have the meeting with the teacher or the administration, and then just follow up, so that way the information is in writing and they could always refer back to it.
Yes, I completely agree, but I think introducing your child, like talking about it first, is probably a lot more helpful if they're asymptomatic. I think if they've had a transplant and you've got to deal with making sure that their health, like especially with COVID and everything else, and making sure that they're in a safe setting from an infection standpoint, that's a different story. But the beginning, when there's no symptom, I think it's better to talk first, then put it in writing.
Okay, great. Thank you. Anyone else? Any questions or any comments?
Just two quick things. First is a comment. As a parent, I was so glad that one of the parents brought up the mystery reader experience, because even in our household, I've noticed, it's really hard when you want to talk to your child who's asymptomatic about this for the first time, and I'm still scarred from my childhood of times like my father sat me down and had the very serious conversation. So you try to think of ways to kind of like naturally discuss it if you're lucky enough to have not experienced symptoms yet. And the mystery reader experience was magical when I finally got picked for that, because I went and I grabbed The Donut That Roared. And that's my favorite, but there are other books that talk about the MRI experience for children. And I was able to say, well, what about this book? Should we read this? Well, what if our friends have questions about this? So anyway, it was the first really healthy conversation I had with my son, just hearing what his feelings were. And so I just wanted to suggest that to another parent who wanted to avoid having this very serious conversation. When the mystery reader experience comes up, go to the book, and it was just really, really helpful for us as a family. And then I just wanted to say thank you so much to the families that contributed these quotes. This is another healthy dialogue going on a lot on social media. And thank you, Connie, for bringing it to life with your experience. I think this is going to help a lot of people. So
Great.
Thank you.
Thank you so much.